It's important after your surgery to know how to use your crutches correctly to make sure your walking is as symmetrical as possible. So remember that your hip replacement can take your weight, there's no problems with that, but often after surgery you're limping because you've got some pain post-operatively, and also you might have been limping prior to your surgery. So your crutches are there to help make you feel more balanced, but they're also there to give you a more even and symmetrical walking pattern. Now your physiotherapist in hospital should have given you some crutches. They are normally at the height of your wrist crease, so if you have your hands by your side, the handle should be roughly at your wrist crease. So that's to know that they're at the right height for you. Otherwise they become too high and you get neck pain. So when you start on 2 crutches, you'll have your crutches, take them forward, then your sore leg, and then your good leg. Crutches, sore leg, good leg. You'll start like that in the first few days after your surgery, just nice, comfortable steps. To progress that onto crutches, you'll take your crutches forward, take your sore leg forward, and then step your good leg a little bit through. So that way you start to have a little bit more of a normal gait pattern, but essentially your crutches stay with your sore leg in order to feel supported. So crutches, sore leg, and then good leg through. As you become more efficient at that and as your pain levels drop, you can go down to 1 crutch. So with 1 crutch, you will make sure that you use your crutch on the opposite side of your affected hip. So if you've got a left hip replacement, you'll use the crutch in the right hand. If you've had a right hip replacement, you'll use the crutch in your left hand. You'll take your sore leg forward or your affected leg forward and take the crutch together at the same time and then step the other leg through. Now the common mistakes that I see as a physiotherapist using 1 crutch is to start leaning this way. So if you're doing that, you need to stay on 2 crutches for a little bit longer, and that doesn't mean things are going badly, it just means we want to have a normal walking pattern for you. So try to make sure you don't lean on 1 crutch this way because you'll get shoulder and neck pain and it's a very uneven walking pattern. So just nice even gait pattern, nice and tall. Your crutch is there more for balance than anything else. Once you feel more comfortable, you'll find that you naturally start forgetting your crutch and just walking around the house without it, and that's fine as long as you're not limping, because if you're limping then you need to stick with crutches for a little bit longer. Most people are on crutches for a couple of weeks. Everyone's a bit different, but by the 6-week mark everyone's much the same. So you'll ditch your crutches when you're ready and don't worry about when that is. Now the last thing I wanted to share was getting up and down stairs. So on 2 crutches, it's a little bit more challenging. I'd always prefer, if you can, to use a rail. If someone is with you, they can take the other crutch, or you can put a crutch in one hand like this if you really need to. But to get upstairs, we say good leg goes to heaven. So you'll take your good leg up the step, and your crutch stays with your affected side. So your good leg goes up the steps and your crutches and your sore leg will come next. So to get up the steps, good leg goes to heaven, it will go first and your crutches follow you. If you're on 1 crutch, it's exactly the same. To get down the stairs is sometimes always a little bit more daunting, but from the top of the step, we say sore leg goes down first. So you'll take your crutches, then your sore leg, and then your good leg. Crutches, sore leg, good leg. So that's how you get downstairs. It is a little bit easier if you have a rail, because then you can hold on to the rail, take your crutch, then your sore leg, and then your good leg, and the rail will give you some assistance. So I hope that information helps you on how to normalise your walking pattern after your hip surgery and use crutches effectively.